Hello, everyone. Welcome after a month's break or and the stress of the session. I'm Sharon Moriwaki, Senate co-convener, and with me I see Representative Hashimoto, co-convener.
Good afternoon, everyone. Good to see you all.
Okay, so we're going to start off today. We're going to go over what came out of. We're pretty fortunate. We did well this year, but there were some things left on the table. But what I thought was really great was that we had a number of bills that we were all working hard on, and I know Hawaii saves many times going forward. So we'll go over the bills today that came out of the session and recap on those and any comments that you might have, as well as some of the bills that we left on the table and what we might do in terms of the coming session and gear up again for the 2023 session. So with that, let's go through. Troy and I will cover the bills, and if you have questions and some of the providers that are here, I see Caroline is on how we might go forward in terms of the bills themselves, of how we might also see how they're going to be implemented. Because part of, half the job is getting the bill passed and signed by the governor. And I hope all of these bills get through without a veto. And after that, how the agencies administer the program so that we can see the fruitful results of the work that you all did. So first up is Senate Bill 2679. And this is the extension of the driver renewal so that it would be 4 years rather than 2 years, where licensees between the ages of 72 and 80 can have 2 more years without having to go through a renewal process. Any questions on that? Just kind of raise your hand or the reaction, or raise your hand if we can see you. I think that's pretty straightforward. So that has gone through. SB 1138 establishes the ceiling for the Office of Healthcare Assurance Special Fund. And instead of them having a ceiling, now they can go in with their budget requests straight to the legislature, and there's more flexibility and more that the agency can do if it needs more funds, rather than have a ceiling on what they can or cannot do. And I think this, and Troy, you can add to this, but I think this is when Keith Ridley told us that during the pandemic, they had funds, they could have used it to get PPEs and also do some of the other projects that they had in mind, but that it was during the interim, so there was no way they could raise the ceiling, so they couldn't spend the money they had to buy things they needed for the Kupuna benefit. So Troy, you want to add to that? I think that's how it came about with that bill.
Well, I think part of it is he really needs it to help him with processing of applications too. That's been an issue. So I think he needs some of that money to start modernizing and doing various things to help him with wait times, which is a chronic issue. I think Senator Moriwaki and I were really having challenges with specific providers who are waiting a really long time for responses. So hopefully this will help.
Well, you reminded me, and the other thing was what came out of, I think, a lot of the work that Jim Shan did with Kupuna Caucus, where they weren't posting a lot of the inspections that they made, and especially those that passed inspection, knowing that was just as important as those agencies that were still under inspection, and they want to finish up the work that they've started in terms of their computer technology to get those things completed. Thank you. And Barbara. So, okay, so the next bill is SB 3113, and this consolidates the Kupuna program, the Kupuna Caregiver Program, which gives flexibility and um, more more services to the community that's needed. And Caroline, are you there? You want to say something about the bill in terms of what that has done for your office or will do for your office? Is Caroline on? Or anyone from EOA? Or anyone wants to say anything about that? But I think this bill kind of came from the administrators. We'll come around to it because I see Caroline will be right back. But if we want to discuss that further, I think, oh, there's Caroline. Do you want to say anything about SB 3113, which is a consolidation of Kupuna Care and Kupuna Caregivers, and what it does to your program and the funding? And,
Sure. Can you hear me okay?
little feedback.
Okay, I'm going to try to talk loud. Can you hear me now?
Uh-huh.
Okay, so Senate Bill 3113 SB 2HD1, I believe, is yesterday we presented it to the governor for approval. So we're excited about that. It will combine both the Kupuna Care and Kupuna Caregiver Program under one umbrella with a dual focus on both older adults and their caregivers. So, you know, having a combined program will help us to be able to efficiently provide services and supports to both sectors, both the older adults and their caregivers. Sorry, I was introducing Maui County Office on Aging to my staff. I'm so sorry.
No problem. So anyone with questions about that and the consolidation, I think it isn't getting less services. I think it'll allow us to get more services because it's going to be they serve the same kinds of services, but it also allows us to pay for caregivers as well when they're needed.
So again, we do have our participant directed program, which is part of Kupuna Care already. So yes, that's an option. Again, everything goes through an assessment and support plan development to the Aging and Disability Resource Center. So those that are looking for long-term services and supports would go through our Aging and Disability Resource Center to look at what options are available to them, both publicly funded and what natural supports they may have in their community. And then after we've done the assessment, then we look at how we can help them with our publicly funded services and supports.
Okay, thank you, Caroline.
Senator, I do apologize. Really quick, we did get in the budget bill the 1.5 million in addition.
So that 1.5 million is on top of the 9 million you already have in the budget, right? So yeah, that's great. It's wonderful. Thank you. And while you're there, because it's not a bill, because it started off as a bill, which was the long-term care ombudsman program. You might as well speak to that as well, or John wants to speak to it. That was one of our major wins of getting in the budget 5 permanent long-term care ombudsman, and what that will do.
Okay, so yes, thank you for Kupuna Caucus's support. I know that this was your top priority for 5 full-time ombudsmen, 1 for each county and 2 for the island of Hawaii, 1 for Kona and 1 for Hilo. My initial request through the department was for the 2, and we were going to build out from there, but this was a very good year. And then it was increased in finance to the 5 full-time equivalents. So that also is I saw it in the budget bill for the 5 full-time equivalents for the ombudsman program. So yes, a very good year. Thank you.
Well, and that's thanks to the Kupuna Caucus and its efforts and support, because it did start off with 2 and expanded to 5, and we really are happy that now we have at least one per island or county.
For Oahu, it will add an additional Oahu ombudsman to support both John and Jamel. So John is our statewide ombudsman, and Jamel is our Oahu ombudsman.
Okay, great. Thank you. Moving on to SB 3289, which is the Hawaii Retirement Savings Program. And this one also is one that we've been working on for a number of years, and it passed this time quite heavily supported, I might add. When I see the 9-member board, there's $25 million put into a fund that would allow the program to get hit the ground running once they get all of their board together. I think it's for 500, is it? Don't know, $500 to the first 50,000 people who sign on to this program. And this is again, it's a individual retirement for those private sector employees who don't have employer-sponsored retirement savings plan. So it's a real boost for our private sector employees who have nothing from their employers. So looking forward to that being implemented. And I see that the Department of Labor is going to be doing the outreach and helping to develop this program. So we may want to ask the Department of Labor back sometime, maybe over the next year, and see how it's going. Any questions? Anybody from AARP that wants to add to that? That's AARP's baby for a long time.
Hi, Senator. This is Audrey.
Hi,
Hi from AARP. Thank you so much for mentioning it. Yes, we were very excited that this bill, it took us 7 years to get this bill
was it
passed.
That long? I know it was several years, but 7.
We all aged. So, and actually it's more than 25, it's 27 million. So 25 million, yes, it's for the financial incentives for the first 50,000. And the 2 million was for operation. And there was $1 million that was really devoted for the outreach and education, so that we could really make sure people understand and sign up for the program, as well as to get the program up and running. So thank you again for the Kupuna Caucus support on this bill. We really appreciate it.
Thank you, Audrey. Any questions of Audrey? Thank you. And thank you for ARP. I know you did the heavy lifting on this for 7 years.
Yes. Thank you. Thanks.
Thank you. And the last bill that was passed is SB 3236, which appropriated funds for enhanced payments to the state licensed nursing facilities, community-based facilities that went through the pandemic. And so these are facilities that care for Medicaid patients, giving them additional resources. I think I see $18 million for that purpose. And it will be DHS getting some matching funds to match those funds. I don't know if anybody from DHS is on that wants to speak to this. So I see that there's also, I don't know if Senator Sanguin Ventura is on, or maybe someone from House, whether we have Rep. Yamani or anybody on. There's budget monies. I see 2.6. Who's that? Who's on? Who's on about the budget? I just wanted to highlight about 2.6 and a half million for the Kupuna Care program. 1.5 million for ADRCs for all the counties, 25.9 million for adult dental benefits to MedQuest patients under option 2. And 500,000 was to the what you heard already from Caroline for the long-term care ombudsman program for the 5 staff. So any questions on our banner year?
Will we talk about some of the things that did not pass?
Okay, so we're done with the patting ourselves on the back, and then now move into what we can cry about. So let's move into, I guess, Rick, you can start it off then with our Cara choice.
Well, there's 2 bills that I was kind of disappointed
Okay.
about.
Go
So
ahead.
our Cara, our choice, and I guess so it didn't pass. And I guess there was a language difference between the House and the Senate. And I guess Rep. Hashimoto, maybe I just asked, what was that difference? I'm not real clear on that. What was the difference in the language? I was trying to understand that at the end.
Yeah, so I think at the end of the day, my sense was that there is still no agreement on the physician assistants and the APRNs. And so I think the prescriptive authority is a very difficult one. And I think we're going to have to figure that out.
Okay.
I don't think it really surfaced in the negotiations at the end. I think there was some other overarching things that people were mad about with that particular bill, with internal discussions. But I think when you distill it down and take out some of the things that were on the top layer that they were trying to say, I think there was some things where I don't think we could find agreement on. So I think the House was very clear on our position. And I knew this when it was passed out from Rep. Yamane. All they were willing to give on the House side is the physician assistants. I think we were okay with waiving some, we brought down the waiting period just a little bit. But I think part of it is, my understanding was there was a difference in the Senate of whether they really wanted PAs. I think they were really pushing for APRNs, but I don't think we can pass a bill out of the House with the APRNs. So you have to remember that the House passed a resolution, and this went through Consumer Protection, that they wanted a comprehensive study of what APRNs do. And that was sent over to the Senate, but the Senate decided not to do it, right? And I think that was passed out in tandem with the aspirational abortion bill that had happened last
year.
session.
Yeah,
so that was the intent, that we would pass this last bill with APRNs being able to do that if we did a study. But then the Senate said, no, we don't want to look at APRNs. We're just fine with APRNs because, as probably Senator Baker is like, well, what's wrong with APRNs, right? That they're the lifeline to the neighbor islands. We don't need a study. It's just fine. So there is a crossroads of where we have disagreement between the 2 chambers. I don't think, my sense was that some people on the Senate like the PAs, which is fine, but I think that's all we can get out of the House. And so if they don't like the PAs, then I don't know where we can go from here. So that's why I'm saying part of it is we might have to just wait to see what the composition is of the legislature in the future. I had a little bit of conversation with Senator Moriwaki already about what can we give and what can we take, and so we have some ideas, but I think it's something that we have to really take a look at as once we know who are in the key committees.
So it's kind of curious that it's passed unanimously through the Senate so many times in a row, and the House seems to be where we get hung up. I guess this is year after year, and it has gone on for as long as I've been involved. So it's just a real difference between the 2 chambers, if you will. So how do we proceed? So our choice, we're going to be meeting in the middle of the month to kind of decide what we're going to do. Last year, you suggested that we write it in a way that we could pass, and we all met during the summer, and I thought we kind of had it going along just fine. We'll be back again with this, but I'd like to work with you guys, or we'd like to work with you, Sam, Trad, and the team, on how to get this through. Because in the meantime, we got people that really inhumanely are suffering,
Absolutely.
not getting this. It's
well, and it's an access issue. Yeah.
Yep. It's an accident. Well, and there's a real shortage. So how do we help with this? From our end and with the House, do we need to do more educational stuff with the House around this? Because we sent out all the last year we sent out all the stuff, CDC information, just a whole lot of information that we sent out. I got some real pushback that they don't want that information, which tells me that they didn't want to even read it. I'm not sure. I'm just guessing by the responses I got from sending out what we sent out last year when it was referred to 4 committees at the end. And this year it's a language issue that really at the last second kind of derailed us. We thought we were going through just fine until that happened and it wasn't even being appointed to be heard. It was a last minute of the session that it actually was heard. And then it was, I hear you all saying, well, okay, we have a language difference. I guess there's nothing we can do. Boom, it's done. Real disappointing. There's a whole community out there that was just crushed by that because we thought it was going through. And they're dealing with already grief around what they're dealing with. So there's an additional, it's a very sensitive issue in a lot of different levels. And I'm speaking as a mental health person, just trying to support folks that are saying, what happened? And I don't have a clear answer for them, what happened. So I guess that's my question here is how do we get clear on how to proceed with this and help it pass next year? People with chronic illnesses and terminal illnesses and less than 6 months to live aren't going to stop happening anytime soon. And we have a shortage that we're going to be dealing with for, that silver tsunami. It's here now. We have a shortage, as much as 50% shortage of staff. Folks on the outer islands can't get the services. So what do we need to do here, I guess? So I'm just, I'm going on, I'm ranting a little bit, but I'm just really frustrated with what happened with that bill. So that's that one. Second one that I'm really disappointed with is, and I'm just going to use the pun I keep using, it just doesn't seem to get heard, is hearing aids being covered by insurances. And that one's almost as frustrating as the Our Care, Our Choice. Our Care, Our Choice, people are dying inhumanely in ways that they don't want to. The hearing aid issue, people that don't have hearing aids, the mental health issues, the psychosis, the increase in Alzheimer's issues, the isolation, all the stuff that happens for them is just off the map. And the cost of hearing aids is astronomical. And this isn't covered. I'm thrilled that dental finally got covered after 13 years. But what's going on with the hearing aids that it's so hard to get that passed? Is the insurance?
So I have a question, Rick. Was the hearing aids, and maybe it's another aid, but
Yeah.
I thought it was that we got an auditor's sunrise
Right.
analysis, right? So that is moving. If it passed,
moving.
Did it pass?
Okay.
Did it pass?
Well, I don't know. So I guess that's the question. What's happening with the auditor's sunrise?
No. So the auditor's sunrise is a good thing.
Yeah. Okay.
Okay. So the auditor will then look at what is the cost, and they'll come back with a study that's
Okay.
done of this is the cost effectiveness. So as much as you can get information to the auditor of what the cost benefits are and what it does with the mental health, or, all the implications, so that he has a broad enough terrain to do an assessment of that, because that's what you have to do before you do any changes. Major changes like that has cost implications. So it's a step forward, is what I'm saying.
So where would we send that information? Is that just going into the?
I think to the auditor, just say, we understand that you're doing a sunrise analysis. We want you to be sure to cover these areas. And you could send it to Troy or me, and then we could also send it forward to the auditor.
Oh, okay. We'll do that. I see Fritz has his hand up.
There's a broad view that these are the impacts of it that you should look at in terms of your costing.
Well, let me close with, so then that's going forward. So once that comes out, then we move forward with those recommendations. We won't have to redo the bill. Our Care, Our Choice, being that it was the end of a biennium, do we have to start over at this point? Yes. Okay. All right. That's all I have. Thanks.
And we could work with you on the Our Care, Our Choice, but it is, as Troy said, it comes down to some. If you look at the different parts of the bill, whether is it, I know some of the people, but it passed the Senate, had concerns about reducing, say, the waiting period, and others, had to do with who's going to be making the decision, whether it's APRN or physician assistant, and maybe looking in terms of what those concerns might be, and then addressing those concerns in the entry.
Well, I know at one point they'd written in that a person has to be seen in person, which was kind of, it can be quite difficult for a bedridden person.
Come crawling in.
Yeah, so I was just curious if that was maybe the language issue, but no, it's still the APRN. Okay, so, okay, I'll work with you guys on that, most definitely, on both of those. Thank you. Appreciate it.
Thank you for your leadership.
Yeah, so real quick on the hearing aid thing, because we worked with this in the Deaf and Blind Task Force. So for many years, the insurance commissioner has said you should do a sunrise analysis. And I think instead I think the Deaf and Blind Task Force chose to just move forward with the bill, because I think Senator Rhodes sometimes has kind of said, well, you don't really need it. But I think at a certain point, you need to keep people to get on board. And so I think this is just another thing that another obstacle we can get rid of if we just do the sunrise analysis. So I think it's worth doing. So at least you can get the insurance commissioner to not have to say in every piece of his testimony, you need a sunrise analysis. So I know it's frustrating for the stakeholders because, I think it was a strategic decision that they weren't doing it and they thought that maybe we could pass it. But I guess because we weren't getting anywhere, we might as well just try and do it from my perspective.
All right, thank you. Thanks for helping clarify that.
Okay, and let's see. Let me see my list.
I think Fritz wants to talk. Go ahead.
Yes, I've been.
Go ahead, Fritz.
This is Peter Fritz. I've been involved with this bill over many years, and I just wanted to clarify a few points. There was a sunshine study done in 2014. And part of the thing was that as far as hearing aids go, most of the policies cover them. The intent of this bill was primarily to include those benefits into policies that weren't existing that don't have that type of coverage now. That's been challenged over a period of years, and the bills have passed forward through both houses and never made it to conference because the House wouldn't appoint conferees. As far as educational or as far as mental health benefits, you can look at my testimony where I cite to studies by Johns Hopkins that shows that it actually could reduce benefits. It could reduce health costs by doing that. Last year, as far as the bill goes in this last session, HMSA was saying they wanted language that said it was medically necessary, which really didn't make any sense since they're the policy holders and they can determine what's medically necessary or not. And it was kind of a red herring. I don't know that this bill will ever make it past the House to make it any further, but the bill is worthwhile. And if you want statistics regarding the health benefits and the cost of adding these benefits to those particular policies, just go and look at my testimony because I cited to these studies. That's all I have to add.
Okay, thank you, Peter. Okay, let's see. Troy, do you have any other bills that?
I think Diane has her hand up.
Oh, Diane? Yeah. Hi, Diane. You have to unmute, Diane. Diane, unmute.
Oh, sorry. I just wanted to check on Senate Bill 2677 about the rent supplement program. And if there's any information about what happened, it seemed to be going along really well. And we were very sorry that it somehow did not get through.
I'm sorry too. I thought we were going to get it. I think the thought behind that was that a lot of money was put into housing and rent supplement program, and that this focus on the elderly within the rent supplement is just kind of caught on the wayside. I do have a call in to Hawaii Public Housing Authority to see whether, I don't know if they could do a set aside, but at least be able to use some of that rent supplement for the elderly. But I think that was part of the problem. A lot of money went to affordable housing, just kind of, because oh, you're already getting it, and by slicing it with for the elderly, I think it just kind of got lost. We could probably go back again next year, probably talk to HPHA and see what we can do for next year.
Okay, thank you.
I think it's a worthy cause, and I think that's one bill we probably should refocus and try again on. I think one of the big things from the House's perspective, I think, was because there was a TANF and TANOF program that was introduced. That was a huge supplement, right? So although that wasn't general funds, but that was a new offering that was never offered before. But I think what we should be probably looking at is a longer term fix when some of these programs run out. I know the regular rent supplement, they have not expanded at all. And so I think that it is worth doing something for Kupuna, but I think part of it is we have to figure out what is the recurring source of funds that will be, you be using to do this. And really what I think was really expensive, and it surprised me, was the wraparound services. So we're gonna have to have a really, we have to have a big conversation on how much we want to spend on the wraparound services versus just actual rent. But the wraparound services are so important that we can't overlook them. And I think that's what was kind of unique about this program, was the potential of the wraparound. So as I said, I think Senator and I already talked about us really wanting to push it again, but we'll probably have to retool a little bit as well.
Mm-hmm. And, if you didn't have the wraparound, I mean, going back to, what the full bill was, then, the elder person could live anywhere, So it's really having that kind of assistance available and focused on that. I mean, I think that's a major difference. Yeah. So what Troy is saying is right. I think we do need separately to be able to have that kind of service for the elderly.
We just see that the seniors have a more difficult time competing when rent supplement does open up for various reasons, including lack of technology access.
Mm-hmm. Is it? I think Diane is frozen. Okay. Are there any other bills? I'm going to move on. Any other bills that we left on the table that really should be circling back to, or anything that came out of the hearings or your discussion that we might want to focus on in the interim to start doing a little bit more homework? Diane, is that you? Are there any other bills? I'm going to move on. Any other? Yeah. That surface or that you're seeing now that are emerging that we should be looking at for our next session. Always looking forward to next session. I don't see any hands or anything in chat. Donald Sakamoto, can you unmute yourself?
Yes, Senator Marwaki, thank you for letting me speak for next year. I brought this up at the last meeting, I think 2 meetings ago, concerning the statewide mobility task force for public transportation for the Kupuna. It was done in 2014 with this Executive Office of Aging, and there was a bill introduced in 2015 and 2016, but did not pass. So I would like to see that worked out for next year. And as a Kupuna who is blind and unable to use the COVID test at home because it's not accessible, it doesn't talk to me. I'm frustrated as a blind individual Kupuna. I can't use those tests to test myself independently. I don't have anybody here to help me with that. So that's a big issue too for the blind. That's all I have to say. Thank you.
Thank you. Is there anybody on from either EOA or ADRC or someone working with services to the disabled elders? Caroline. Yeah, can you address Donald's question? There's two parts to it. There's the part that's on the blind, and they need help, you know, in administering the COVID test at home. Anybody that you can refer him to now? I think his problem is now.
Yeah, I can, Donald, I can give you your information and we can connect. We have our long-term care disability specialist here in the office, and maybe he may have some resources that can help. He's off today though, but Senator, maybe I'll work through you and then I can email Donald and hook him up.
Okay. So Donald, do we have your email address? If not, can you put it in the chat? Oh, no, you can't, right? Can you just offline?
I'll call your
us?
office. Yeah, I'll call your office and let you know.
Okay. And then I see Peter's hand up. So Peter works with the blind, so he might have something that might be a resource. Peter, on this issue?
Actually, it wasn't this issue. It was to comment on a different issue.
Okay, so hold off then. So yeah, so Donald, if you can give us your contact, and then we can get you in touch with resources on the blind COVID test issue.
We have his email if he's on it.
Oh, okay. We can use your email. We have your email if you're online with us.
Okay, thank you.
Okay. And as for the mobility, Caroline, since you're there, there's this mobility plan that was done way back in 2014.
Yes.
Yeah. Can you dust it off and see whether
we do have that in our resources. I'll look at our resource library. We do have that report, and maybe we can bring it back and discuss it at the next caucus meeting. If you want us to do that later?
Yep, sure.
Okay.
Yeah, that'll be good to circle back to and see what's happened with it.
Yes, and I think Donald had brought that up before, and I do apologize that we will bring that back to.
Okay, we'll put that on the agenda if you're ready to discuss it. Okay.
Appreciate it. Thank you.
Okay, thank you. Peter, your hand is up.
Yes. My issue relates to the participation of Kupuna and people who have disabilities in public meetings. Recently, I've encountered a number of problems in participating. A Department of Health agenda said, if you need to dial up, call and use the number above, and the number above for getting the dial-up information, because you didn't have a computer, which is what they said you could get the dial-up information, was a link, meaning you had to have a computer to use it. Dial-up information is necessary for people that have disabilities or Kupuna, or those people that live in areas that don't have broadband coverage, because it's very difficult to watch a video on dial-up coverage. The OIP's office, OIP takes the position that it's not necessary for an agency to publish dial-up information on their agenda because it wasn't in the statute. But neither was anything else in the statute about defining what information was necessary. So OIP's position is, if you need dial-up, too bad. And so, and I have that in a letter from them saying because it's not in the statute. So it may be reasonable to revisit the issue of what constitutes necessary information for remote meetings, and clarify that in the legislature, in the legislation. I do know that OIP has not been particularly open and says that anything dealing with disability isn't their responsibility. However, my position is that including information on how to request an accommodation, or including information on how to dial up for those people that don't have technical expertise or don't live someplace where they can, or want the information so that they can go and work with a remote captioner to provide captions, is something that's not a disability issue, but it's an access issue. We want transparency. It's not transparent when some people are excluded from meetings at this particular time because there's no requirement to include all of the information that one has in order to dial up. You look at this meeting hearing, and there is that dial-up information so that people can use it. Another problem has been is that if you call up requesting an accommodation, several times I got dumped into a phone queue and nobody answered, or thank you for calling, click, or thank you for calling, please call so-and-so. You call so-and-so and that number's not working any longer. So my proposal is a simple one. Revisit the remote hearing, the remote meeting information and what's required in a notice, and specifically include information that includes the dial-up number. I worked for several years to have information on how to request an accommodation included in it, and finally got that legislation passed. This is something that's important for Kupuna that just really aren't as technically sophisticated, and it impacts on a lot of other people. Thank you.
Thank you. At first, Caroline, and then Donald. Caroline.
Senator, I don't know if there was anything that someone wanted to comment on from what was just said. I know that there was discussion about what should be in the next legislative session. We just wanted to revisit the SHIP bill and the healthy aging bill.
Okay. Yeah. That as well. I don't know what happened. Troy, you know what happened with the SHIP bill? It seemed to be going along. Oh, was that the bill? Let me just take a look real quick.
It went to conference. And funds weren't.
Was it in conference?
SHIP went to conference. Healthy aging.
Yeah, it was in conference. Troy, do you know anything about the SHIP bill? What happened in conference?
I don't know.
This was
we probably should follow up.
Yeah, we could.
I think at the end of the day, there was just too many things that we were trying to get, so we had to like really prioritize what was the most important. So we were making a lot of asks, so we didn't have any asks at the end. So we had to prioritize. I think that's really what happened.
Yeah.
You know, we put a lot of energy in our choice, and that we had to get that scheduled. We got the ombudsman fairly early, so that helped. Even Caroline, you know, Sharon put a lot of energy into getting the Kupuna Care program, you know, on the House side.
3113, yeah.
So, yeah, I think it's something we are interested in. It's just we couldn't obviously get it all done this year.
There was so much, and there was so much that was at stake in terms of, well, we tried our care of choice, but also the ombudsman getting the positions and making sure that it went forward. And as Troy said, also, you know, that trying to combine in 3113, the two programs. So you could only do so much for so much by our colleagues. So we could certainly look at what happened and circle back and see what we can do for next session. And it might be educating more, because one of my colleagues said, oh, you know, I got this really good thing in the mail about, you know, Medicare. And that's a really good thing that they're providing, but you know, the connection isn't there. So maybe part of it is also educating what SHIP really does for the Kupuna or others thinking of retirement.
And you know, Caroline, that reminds me, you know, I think what might be interesting is some of the members are always looking for newsletter content or postcards to send out during the interim, not necessarily this year because it's an election year and we have a freeze on mail after filing deadline. But I think just put in the back of your mind as the new session starts, you may want to be like, hey, I have
Good
this
idea.
mailer you can use that's already out of the box to help educate your constituents about one of your programs. And I think it's a double-edged thing for you because it's informing their constituents, but you're helping to inform members that otherwise wouldn't get to know some of your programs. So I think it's something for you guys to consider.
That's
So I think you guys have great programs.
Yeah, it's really, really great because you have to educate us as well, you know, and the more you can help us to educate our constituents and the constituents, you know, get help from it. I think Troy brings up a really good point is that you can give it in little tidbits, but then we know the program. So when it comes up, oh yeah, you know, I got really good feedback about that program. And then, you know, you get more support. Yeah, that's a good point. Donald, you have your hand up, or is that from the old one, or is that new?
No, Senator, I just want to elaborate what Peter Fritz said about accessibility for those with disabled accommodations. As a blind person, I have friends that I know who don't have technology. They're totally blind. And for them to remember all these numbers with the comma, and the pound sign, it's very difficult for them to call. There should be more accessibility where the party can call them in and have them on hold to testify for, committee meetings or whatever. But there is a software. I've been trying to work with the state clerk at the Capitol with the state side and the House side to see if they can buy that software for next year so they can accommodate persons like that who don't have the technology or the way to call in with these numbers, because I can't remember that many numbers too. I'm fortunate to have computer and a smartphone, which I can afford and put that in my contacts. So that's another issue, I think. But thank you for allowing me to speak, and thank you, Peter, for bringing that subject up.
Okay. So if Peter, you or Donald have these suggestions, it would really be helpful for us to take it forward to have more specific information. And we can say, this is I don't know what you call it, call in number or dial up or whatever that equipment or software is called, so that we know what to ask for as well. It would be helpful. So just email it to Troy and me, and we will work on that, or with Caroline. Caroline, you have your hand up, or is that, yep, down, up? Yes, hi.
Hi. There is a question in the room, Senator, about the Aloha homes and what, I guess we wanted to.
Troy knows all about it.
Representative Hashimoto.
Yes, Representative Hashimoto knows all about that, so I'm going to refer you to him.
What aspect of are you asking about?
Hold on, Barbara, come ask the question.
Barbara.
I read in the paper that it passed, but if you look on the Capitol website, it looks like it just kind of stopped mid-April, I think, or maybe early May. So I didn't know if it passed or not. I wanted to ask someone that at the convention last week and I forgot. So that's what I'm interested in. Thank you.
Yeah, so Aloha Homes, I think that's Senator Chang's biggest, thing that he wants to move along. And I believe we moved out a version of it from housing. My memory might be a little clouded, but we did work on it a little bit in house housing once he sent it over. I don't know if we passed it out or we deferred it, but it didn't move anywhere after that. So there was no movement on Aloha Homes itself. I think there's a lot of iterations of Aloha Homes that, Stanley calls it Aloha Homes, but he's had many iterations of it over the years. And so I think part of it, though, is there's portions from Aloha Homes that, have been moving forward that I think will be useful. I think part of it is HHFDC or mixed use for HPHA developments. I think some of those concepts were what Stanley contemplated in Aloha Homes. And so I think there are elements that will continue to push. I think I always tell Stanley the hardest part about his proposal is that he wants a wholesale change in one bill, right? And unfortunately in Hawaii, for housing changes to happen at that level, you just don't have that type of appetite, right? Even the small stuff that we try and push, which is, you know, the mixed use for HPHA housing, that's a really big ask, right? It takes years for us just to pass that small thing. So, you know, every time I tell him, I say, you just got to break it up and you take the wins that you can get. And so I think he's realizing that. I think he wants Aloha Homes is his version to keep the conversation going. And I said, I always tell him that's really important, right? I think we need to keep housing top of mind, try and bring in new ideas. And so I think part of it is we have to keep that momentum going in the next session, because I think so much money has been put into it, into solving our housing crisis throughout the state, that now is actually the hardest part, is the implementation. And so I think a lot of next session is really looking at some of the way that it's being spent, and if we can't spend it, how can we repurpose some of the funds? So I think that's where a lot of the energy and focus will be going towards.
Yeah.
And especially towards Kupuna housing, right? I think Sharon and I really have a sense of that's what we have to also tackle.
Mhm. Really getting more affordable housing, but you know, the rentals are what is easier to sell than for purchase homes, but we need both. I don't know, Troy, you want to talk about your Yes in My Backyard? Because that's one way of, you know, looking at some of the zoning that are challenges in the counties that we can't build as much as we would like to build affordable housing. So there's a working group, right, that you folks are.
Yeah, so essentially it has the interesting name. I think the realtors came up with it, but it really is just a working group to bring all the important stakeholders together, because there was actually no mandate for all of these stakeholders to meet together, although that would just make total sense, right? That you would have all the counties and the state agencies that relate to housing to sit to figure out what are some of the things that we need to work on. So I think we just said in a bill that HHFDC is going to have to coordinate this working group to see what are the steps that we need to happen to move the needle even more on some of our affordable housing issues. I think we're in a good place more than ever, or maybe more better than, you know, the last 5 years, but I think we need to continue that momentum, as I said. And I think this is that next step, is mandating that everyone gets together. There's actually money attached to it. So usually, typically, a lot of what the legislature sometimes passes is an unfunded mandate, but we actually gave HHFDC money to make this happen. So I look forward to some of the results. And I think that might be a springboard of what you see from the housing committees being pushing in the next couple of sessions, is what this group comes up with. So you know, we'll see who gets appointed from the House and the Senate, but I think, of course, we will always focus on those underserved groups that need assistance the most.
Thank you. Thanks. Yeah, that's great. You folks did some heavy lifting there in the House and housing, so it's good. Every little counts and it builds for our affordable housing. Because our homeless problem is there because we have no housing. So it all kind of, you know, hooks in together. Anything else, anyone? We are getting close to our bewitching hour. If you have nothing else, I do want to bring up something that Caroline and I are involved in, and we want to bring in Troy too. It's the Council of State Governments Long-Term Care Task Force, and these are a number of states that have been brought together. The Council of State Governments is a organization that provides resources and support to legislators. And brings in administration to solve various problems. And their focus on long-term care is in terms of the direct care workforce, and compensation or training for them, so everybody has the same problems. Looking at federal funds, how we can better use the federal funds and use it as ways in which we can support broadening the programs that we have for the elderly. And so also regulatory reforms to assure that we get the best care for our seniors in long-term care, whether it's community-based or nursing facilities. So we are putting together what might be some issues for us and where we might want federal or even better state coordination and services for our seniors who need, our frail, vulnerable seniors who need long-term care. So if anyone is interested or has concerns or is working on that, contact Caroline or me. And we are looking toward, Caroline, what was it? Do you remember? Was it mid-July or end of July where we would want to call together some people to have a thinking group?
The last Tuesday in July, and I'm not sure if it's July 26th or 28th. I don't have my phone right in front of me. Shelley.
Yeah. So the last Tuesday in July.
Tuesday in July, right?
And we hope that we could be a productive session and focused on what we might do to have better services for our vulnerable elderly, those in long-term care facilities or in community-based facilities, that we can assure that we have some policies in place if we need state policies or even federal, how we might be able to impact on the federal Medicaid system as well. Caroline, you want to add anything more to that?
No, Senator, but what's really, well, I guess I do want to add something. What's really telling from these sessions that I've been in, and it's only been the first two, is that very similar themes, not just here in Hawaii, but throughout the nation, and to realize, okay, we're not the only ones that are grappling with various issues with workforce. So in that respect, it's been a good, and I think now being able to focus in on Hawaii in the next month and then going back to the larger group will provide some guidance for us. Thank you.
Mm-hmm. Thank you. Yeah, everybody's facing what we are hearing from some of the caregivers, the care facilities, is that they're losing good workers to the hospitals, the compensation, the training. We don't have enough workers. So some states are providing more compensation to the direct care workers. So we might want to look at other jurisdictions and what they do and see what we might be able to borrow from them or take from them for us to go forward in making sure that long-term care is something that we can see providing better services to our vulnerable. So that's one thing. So if any of you are interested or concerned and want to join us, please contact Caroline and me. And I think that's all. And talking about vulnerable, I think Heather Boland sent out this World Elder Abuse Awareness Day, this financial abuse session. It's for an hour and a half. It's with HPD, with Financial Industry Regulatory Authority, Securities Commission, DCCA, and DHS, talking about financial abuse of seniors, and that's a big problem as well. It's on June 13th, and you should have received an email on that. Oh, Ron has his hand up. Hi, Ron.
Hi, Senator Moriwaki. If I may, if I could do a quick plug, I'm Ron Chimabuku from the Alzheimer's Association, newly appointed Director of Policy here. Just a quick plug, an upcoming Caregiver Symposium that we're putting on June 15th to 2 p.m. So I believe Heather did send out an email information out for that session. We have wonderful speakers lined up. It is via Zoom again and free of charge. So please share the information and we welcome your attendance. Okay. Thank you, Senator.
Okay, thank you. So Heather did send it out to everyone, to Ron?
Yes, correct.
Okay, so please look for that as well. Alzheimer's is an important disease, I guess we can call it, that we should know about and we should prevent if we can and work with treatment. And you folks will cover all of that, yeah, in your
absolutely. Caregivers specific.
Caregivers.
Yes.
Yeah.
Thank you.
Okay, great. Thank you. Anything else? Any other announcements? Okay, I think we can call it a wrap. Yeah. Okay, thank you everyone for joining us. Appreciate that. And if you have any ideas, any other ideas, please send it to us, Troy or me. And we will follow up for the next time. I think the next meeting is in July. July. You know, July. Let me see. You should have that. The July 8th. No, July 1st. July 1st? Really? Oh yeah, July 1st at 2 p.m. We will see you just before the 4th of July holiday. So, aloha.